Now let's talk about the assessment of the symptoms and severity. So usually we've talked about this. Commonly we make a diagnosis based on the history and examination. Sometimes we also use certain diagnostic interviews. We use certain rating scales. Again, that are not necessary, but again we sometimes use them. And especially if you're in the initial phases of your career, in the initial phases of your residency, I always recommend try to get hold of some of these diagnostic interviews or these rating scales and try to apply in the patient, so you will get an idea how to apply these scales, these diagnostic interviews. And also we see sometimes in researches, you will see a lot of studies and articles that some of these important measures, instruments have been applied. So let's discuss some of the important instruments. So we'll talk about some important diagnostic interviews for screening OCD and subsequently to ensure accurate differential diagnosis. And also we'll talk about certain important instruments for measuring the symptom, for assessing the severity, and also certain other features. So first let's talk about DSM-5 TR. So DSM-5 TR, you will see in the later part of the DSM-5, you will see self-rated level 1 cross-cutting symptom measure, and it has two items for obsessive compulsive and related disorders. And this can be subsequently followed by the level 2 repetitive thoughts and behavior scale. So in level 1, you will see two questions related with the OCDRs, and subsequently you can follow it up in level 2. So in level 1, the items, two items which are focusing on obsessive compulsive and related disorder. One is unpleasant thoughts, urges or images that are repeatedly enter your mind, and about feeling driven to perform certain behaviors or mental acts over and over again. So these are two items focusing on OC and related disorder in level 1.